All right. Hello, everyone. Greetings, and Happy New Year. Welcome to the WCEG Network on the WCEG Talk Radio. We are the worldwide community empowerment group where we speak life into the community. I am Dr. Babs, your show host for the first evening segment in 2022, The Holistic Perspective. We are going to have an amazing hour of empowerment, encouragement, and education as we discuss strategies of how to optimize our thyroid health. This is the Thyroid Awareness Month, and it behooves us to be aware of our thyroid and know how we can best serve our body by keeping it healthy. Now, we are live on all social media outlets, just name it, Twitter, YouTube, Facebook, and the radio network, WCEG Radio Network. So please tag a friend, tag your neighbor, so that you can stay updated with all our programs. We are here to impact, and we support all your engagement. But before we get started, two quick disclaimer. The information shared on this radio talk show is not intended as medical advice, so please maintain your relationship with your provider. It's just to serve as an educational information to support you on your holistic journey. And secondly, the views and opinions expressed by the host and guest do not necessarily reflect the views and opinions of the WCEG network and management. So let's get started. I like to start with an inspirational quote, and the one that I want to mention today is by J.C. Polillo, and it says, "Be good to your body and your body will be good to you." Now, isn't that a fact? If we treat our body right, it will, in effect, do the right things for us, right? So you spending time to watch live, or if you're watching the replay, you are investing in your health, and your health will thank you for it. It's all about learning about our thyroid gland. Unfortunately, quite a number of people don't even know that they have thyroid issues. So we're here to educate ourselves about what the thyroid gland is all about. Now, just in case you're tuning in, again, welcome. I'm Dr. Babs, your host for the WCEG Holistic Perspective Show. We are here just to empower the community about their health in a holistic manner, body, soul, and spirit. So we're going to be talking about the thyroid gland and strategies to optimize our thyroid health. So my goal this evening is to discuss what the thyroid gland is. We're going to look at the different conditions of the thyroid gland and what are those risk factors, just in case you're wondering, how do I know if I have a thyroid issue? Well, we're going to talk about that. And we're going to talk about how we can prevent thyroid disease, and if we have thyroid disease, how we can manage it. So I welcome your engagement, your questions, so send them in. All right, we're all about empowerment. We're all about answering those questions so that we're healthier and stronger together. So let's get started. So first and foremost, what is that thyroid gland? What do we know about the thyroid gland? Well, the thyroid gland sits right here in the neck. It's a small gland, but it's very powerful, very powerful. It controls all the endocrine systems. And you've probably heard of your provider, your physician talking about T3, T4. Well, those are the hormones that are produced by the thyroid gland, and it pretty much speeds up the metabolism. So it's either, if it's moving at its normal pace, all things are good, but it could either be too fast or too slow. And so it impacts our metabolism, and it dictates how our body functions and how we feel generally. Now, it's important to know what those symptoms are, right? Because if you're not aware, then you don't know what to do. So since we mentioned that the thyroid gland sits right here, the hormones are regulated from the brain. So if the brain notices that, yes, we need some work to do, it stimulates the hypothalamus, stimulates the pituitary gland, which says, oh, thyroid, you need to produce some hormones because we need to wrap up our metabolism. And so that's how it works. And the interesting fact about the gland is that the hormone functions in different aspects of the body. So you just name it, the gut. So symptoms that you can find with people that have thyroid issues is that they might be bloated, they might be constipated, they could have diarrhea. It also works with the heart. So many things can happen. They can have palpitations, or they just feel anxious, or if it's low production, You can feel very sluggish. Sometimes you're either sleeping too much or excessive. So it depends on if it is high amount or low amount. Skin could have some skin problems because, again, like I mentioned, the thyroid gland, the hormone, goes all over the body. It has receptors in every system of the body. So that's why we call it the power source. Now, other things that it can do for females, sometimes they can have excessive bleed or no bleed at all. It can also affect appetite, where you just are eating a lot. You're eating so much that you're not even gaining weight and you're wondering what's going on. It's because it's very fast. It's moving at a fast metabolism rate, or slow, where you're not eating much, but yet you're gaining a lot of weight. There are other symptoms that you might pay attention to, and you might have already heard. Cold intolerance. So that means, well, everybody's hot, but you're feeling cold, or vice versa. Everybody, you're in a hot season, but you're feeling cold all the time. So there's so much that can happen. And those are just to mention a few of those symptoms that patients can complain of that would give you an idea that the thyroid is affected. Now, let's talk about a few of the conditions. So I mentioned hypo and hyper. Hypo is when the hormone is not secreted at the rate that it needs to be. So it's slowed down. So your body, as you can imagine, it's not working at its peak best. And the same thing, if it's hyper, then you have excessive secretion of the thyroid gland, the thyroid hormone from the thyroid gland. And that usually leads to all the symptoms that patients complain of. Is there a family history? Yes, it can be related to family. It can be tied to family history, especially the hyper. It might be that, you have patients that, first generation have thyroid disease. So that's why it's always important to find out from your family, is there a thyroid problem in the family that I need to know about? So that when your doctor or your provider is asking those questions, it can give them a hint of what they need to do to help figure out what's going on. Because sometimes the thyroid diseases can mimic other conditions. So it's always best to know if it runs in the family. Other things you want to also pay attention to, not just the complaints, but how do you look? What are your vital signs like? What is your blood pressure like? What is your pulse? Sometimes people just have rapid heart rate. And sometimes they might not feel anything, but they just feel that the heart rate, when they examine them, the pulse is really high. Sometimes the respiratory rate might just be, normal or shallow. There are several symptoms that you need to pay attention to. Of course, weight. If you're gaining a lot of weight and you don't think that you're eating as much, that's definitely something to check up on. I've had several patients that were diagnosed with thyroid disease just because of an excessive weight gain. So that's something to pay attention to. If your weight has just increased over a short period of time, you want to talk to your doctor, and so that they can do the appropriate test to find out what's going on. Now, speaking about appropriate tests, what are some of those tests? You might have heard of TSH. That's commonly the thyroid test that we tend to hear a lot about. And that is just the midway to the thyroid gland. So that is a messenger that tells the body that, well, we need some production of the thyroid hormone. And so that is baseline what we check, but that's not the only test that we need to check for. We also check for T3, which is the active form of the thyroid hormone, and the T4. So when next you're with your doctor at your doctor's place and you're concerned about any of the symptoms that I mentioned, always make sure and talk to them. Are you checking a T3, a T4? Because if you only check a TSH, you might not find anything. And a lot of patients will still be having symptoms and they're wondering, what is going on? I don't feel right, but my TSH is normal. It's because it could be a subclinical presentation. So always make sure that you get the whole panel so that you get the full assessment of your thyroid gland. Now, of course, if you notice an enlarged mass in your neck, that requires additional studies. So your provider might decide, well, let's do an ultrasound and let's see if there's nodules. Because if that, commonly you will see goiter. That is more of a goiter, what we call an enlarged thyroid gland. So they always want to do an ultrasound just to find out what's going on. Why is it hypersecreting? Other signs and that means symptoms, demonstration of thyroid disease would be sometimes they have like the bulgy eyes, and that just shows signs of hypersecretion of the thyroid hormone from the thyroid gland. So an ultrasound could be required. Depending on what they find, they might do a biopsy just to see the consistency of the thyroid gland. Now, you don't always want to jump into conclusion, right? Just because that is enlarged, your thyroid gland is enlarged, does not mean you have a thyroid disease. So always check in with your provider to make sure that it is required for you. There's some examinations that they will do that will let them know if they need to do an ultrasound or if they need to do a biopsy. All right, now, so those are the basic test panels that you need to have checked. Now, let's say just come back and there is a thyroid problem. So the thyroid problem can range from low thyroid production to high thyroid production, or maybe you've heard of goiter, which is the enlarged thyroid gland, or maybe you've heard of Hashimoto, which is a very common thyroid disease, and all that means it's an autoimmune disease where the body, it's actually attacking itself, just like most autoimmune disease, where the body, unfortunately, is recognizing itself as a foreign object, not to make it complicated. And so, unfortunately, the antibodies attacking itself. So that would be another reason, another form of thyroid disease. So depending on what it is, will determine the treatment. Now, the beauty of thyroid disease is once we catch it and we know what the issue is, you can treat it at the source. What is the root source? What is the root cause of the problem? Depending on what that is, you can treat it appropriately. First and foremost, medication is one of those, but you don't want to do that in the absence of your nutrition. Nutrition is so fundamental for thyroid health in so many ways. There are several things that actually help to keep the thyroid in a healthy state. So other than nutrition, and of course our nutrition always goes back to having a plant-based diet, so predominantly plant-based. Now, I'm not saying if you eat meat, don't eat meat, or if you eat more of other things that are not plant-based. Just make sure that majority, predominantly all your foods are more plant-based. Our natural recommendation is 3 servings of veggies and 2 servings of fruit. That's on a minimum, right? And that ensures that you have all the antioxidants, all the minerals and vitamins that will support your thyroid health. If you're eating a bunch of processed foods, that's not going to help stabilize your thyroid gland. If you're eating a lot of sugary drinks, carbohydrate drinks, that's not going to support your thyroid gland. So first and foremost, having a well-balanced diet. So even if you're not diagnosed with thyroid disease, definitely that helps to support the thyroid gland. But if you are even further, you want to make sure that you are supporting your thyroid gland, because the conversion, as you heard me talk about the TSH to the T3, T4, it needs the right environment to strive. So if you're feeding it the right, you remember the quote that I said, you treat your body right, it will do you right, right? So if we give it the food and the nutrients that it needs, hydration, right, antioxidants and everything that will help support your thyroid health, then your thyroid is balanced. Other things that you can do to help support your thyroid health is reducing stress. Stress is a key factor whenever we're overly stressed. Now, stress, again, you might have heard me say this if you're someone that listens to the Holistic Perspective segment, you might have heard me talk about stress. And stress does have it plays a good role in our lives, meaning that it keeps us ready for tasks ahead, but we don't need to be constantly in a stressful environment. When it's a prolonged stressful environment, then we begin to increase our cortisol level over a long period of time. And unfortunately, the thyroid gland does not strive excellently well in the presence of a strenuous environment where you have increased cortisol level. So we want to minimize stress. So we want to inculcate stress management techniques. And there's several ways we can do that. Well, through journaling, we can meditate. We can go for walks. We can pray if you're a praying person. There are definitely ways to minimize our stress. I've read so many places, and I'm sure you're familiar that 90% of what happens to us is really how we react, right? So 10% is, I think it's somewhere around 10% is what happens to us, and the remaining 90 is how we react to it. So finding ways to manage stress, that would be very, very essential for thyroid health. Now, other things, definitely making sure that we have enough protein in our meals, in our diets. If we're deficient of protein, remember, protein does help with cell development, with muscle build. If we're deficient in our protein, then it can also affect thyroid health. There are some deficiencies in like minerals, like selenium, that is found a lot in our leafy greens, our nuts and seeds. If we're missing that, then we can affect our thyroid health. So there are quite a bit of things that we need to pay attention to. We need to make sure that pesticides, we cut back on those. Unfortunately, it's everywhere. So that's why we do encourage organic fruits and veggies, because a lot of our non-organic ones have a lot of pesticides that contaminate our food, and unfortunately they interfere with the thyroid hormones. So we want to make sure we minimize that. If you're able to grow your own farm, that would be fantastic. That's something I'm hoping to do in the next few months, to grow my own veggies and fruits, because that will minimize how much pesticides our veggies are encountering. It definitely plays a big role in how our thyroid functions. We want to make sure that we look out for other chronic diseases. So is it the kidney? Is it the liver? If those are not up to par, you can imagine the excretion of the thyroid metabolites can be affected. So we want to make sure that those are strong and healthy. And how are those strong and healthy? So avoiding alcohol, because if you drink excessive alcohol, that is, the liver is the detoxification organ. So if you drink a lot of that and the liver is already affected, whether through fatty liver or alcoholic liver, you can imagine the thyroid is not going to work at its best. So paying attention to those things that we take in that can affect our thyroid. Other things is kidney. Our kidneys need to be supported. So how do we support our kidneys? Staying hydrated. Gotta drink the right thing. Drink water, stay hydrated. Our body is made 70% of water, and without water, our systems slow down. So if the system slows down, imagine the thyroid gland also won't be able to work at its best. The conversion of the T3 to T4 to T3 wouldn't take place. So we definitely need to make sure we're staying hydrated. We drink lots of water. Another thing that can affect our kidney is if our blood pressure is high. If our blood pressure is high, or if there's uncontrolled diabetes. So these are chronic diseases that can indirectly affect the thyroid gland. We want to make sure that we avoid that and make sure that, we're eating the right foods, taking the right medicines, having the conversation with our providers to make sure that we are optimizing our health overall to minimize and decrease chronic diseases. So these are a few things that we can do to help our thyroid gland work at its best. Now, there are a few more that I want to mention. We have to make sure, especially for our ladies, because thyroid disease does affect more women than men. And so we want to make sure for our women that if you're an oral contraceptive, that you're talking to your provider. If you're having any of the symptoms that I mentioned earlier on, if it's skin changes, if you're having cold or heat intolerance, if you're eating excessively and gaining so much weight, if you're just sluggish and you have no reason why you should be sluggish, it has nothing to do with not sleeping well. So all those things, if you're finding that you have any of those things, you definitely need to talk to your provider, and especially if you're on oral contraception. Now, we have a few more that I want to mention. Certain medications have been known to affect the thyroid, and lithium is one of those. So you want to go over your medication with your provider and make sure you don't have any of your medicines that is affecting the way that your thyroid functions. So we've talked a lot about just our nutrition, our health, how we can manage our thyroid. Now, let's talk about the medications though. So let's say we've done the test, TSH, and it is confirming that there's a low thyroid. So we need to replace the thyroid. hormone, because without that, your body's not going to function the way it's supposed to. I do want to mention that the synthetic levothyroxine, which is the most common thyroid replacement hormone that you get in form of pill, is not the same as your body's natural thyroid hormone that you get. So you do want to make sure that you have that one-on-one with your provider, because they would need to adjust it to where your body is unbalanced. So you want to have that regular appointment with your doctor till they can get you to a stable level. And that's usually monitored by doing labs. And they will talk to you about what you can eat, what will help to promote thyroid health. Some of them I've already mentioned in terms of your leafy greens, eating lean proteins, avoiding excessive sugar, making sure that you're not putting any burden on your liver or your kidney. So you would get the levothyroxine, which is a synthetic hormone that will help. And that's usually once a day you will take that, and you would just monitor your thyroid gland, your hormone. Now, what's about if it is hyper? So depending on what's going on, if it is because of an enlarged thyroid gland and it's excreting a lot of hormone, then that could be surgically removed. Sometimes there's radiotherapy just to shave off some of that excess that is there, and most times that you would subsequently have to be on a thyroid medicine just to supplement what they've taken out. So those are options that your provider will have one-on-one with you. But overall, the whole reason why we're going over this is because not many people are aware that they have thyroid disease. It is estimated almost, if the last time I checked, it was a good amount of patients that were walking around that had no idea that they had a thyroid disease, because it can mimic other conditions. And some conditions that it tends to make is if somebody's anemic. Typically if you're anemic, you're feeling weak, you're feeling tired, so you wouldn't know it's your thyroid. But the difference with being anemic and having thyroid issues is that anemia doesn't have much to do with constipation or diarrhea or fast heartbeat or slow heartbeat. So you can actually very quickly discern whether it's more of a more complicated issue with the thyroid versus it's just anemia. So it's important to pay attention to these symptoms. I have several examples of patients where we diagnosed them. One was, as I mentioned, it was just because they just gained a lot of weight. Some could be very clear-cut. It could just be that their eyes were bulging and they felt a lot of pain. Some could just be that they were just having really brittle skin, or some just bleeding excessively. So there are various symptoms that patient can have. But the important message here is to always pay attention to how you feel. Don't take it for granted that it's just one of those things where I'm getting older. It must be old age. Don't ever think that. It does, it's scientifically proving, though, that as we get older, our thyroid gland and its function diminishes, but it still should be working at its optimal if we're giving it the right food. Again, remember my quote, if we treat our body right, it will treat us right, right? So that's important. Now, what are some of those supplements? I've had patients ask me this question: how do I support my thyroid? What vitamins do I need to take? Now, if you are eating the right foods, more than likely you don't need supplements, but because of the way our foods are made and the transport system, and when it gets to the store and how we cook our foods, there might be need to supplement, which is augment, not to replace eating healthy, okay? So I want that to be very clear, that we're not trying to replace eating healthy. We could just supplement. And so some supplements that help with thyroid functions could be, that has been shown, is rosemary, zinc, chromium, potassium, vitamins, all our vitamins A, B, the B complex, psyllium that I mentioned. Psyllium can actually be found in nuts. The Brazil nuts is one of those that have lots of psyllium, but of course, portion control. You don't want to overdo the nuts. You just want to support your thyroid health, and anything that will help to reduce or minimize stress. So quite a bit of information that I've thrown in here. I hope that this has been helpful. I want to make sure that, let me just see if we have any questions. Give you time to Give you time to answer. Okay, so it looks like we have one question, I believe. Okay, so yeah, the important question here that I want to go over that a colleague of mine had actually asked me to ensure that I emphasize with thyroid is not to adjust your medication on your own. I've seen this happen a lot where, well, I'm still feeling sluggish. I'm not feeling up to par. Maybe I might just increase my levothyroxine. That's a no-no. You always want to do that under the supervision of your provider. Make sure you call into the clinic. If you still don't feel where you need to be, we usually estimate about, once you start on medicine, somewhere between that 4 to 6 weeks before you see any improvement or any changes. But if for any reason you don't see any within that time frame, please don't adjust your medication on your own. Just make sure that you put in a call so that you can be evaluated, and based on your test would support whether you need to increase or decrease the dose. So that's very important that I emphasize that. Well, it looks like that's all I have today. I hope that you found it very beneficial. And let's see, is there a question? What determines if the entire thyroid will be removed or just the gland? Okay, excellent question. Well, so it depends on the size. So remember I had said that if you have an enlarged thyroid, right, if you just feel that it's just enlarged, sometimes it could be one side more than the other. Sometimes it could be symmetrical. So that's really what determines how large it is. Is it encroaching against your respiratory system? So that will determine how much of it. Now, if it's cancerous, definitely you would want to remove that entirely. If it isn't and it's just a benign, then they can just take some of it. So those are usually the determining factors. As a primary care provider, we do manage patients with thyroid issues, but we do co-manage with the endocrinologist. So most times if you have a thyroid issue, you will be referred to an endocrinologist to do the procedure that needs to be taken out. Again, with hypersecretion, it could be radiotherapy, it could be surgical, and most times there are medications that actually will reduce the excretion, but ultimately, depending on how much of it is taken out, you might take out too much and now you have to replace. And most times it's better to take out more and replace than to have excessive. So those are some of the factors. All right, what meds is prescribed once the entire thyroid? Well, it'll be back to replacing the thyroid hormone, and it will be levothyroxine. That's one of them. And another name is called Synthroid. So those would be the medications. As I mentioned, that is if you're replacing, right, the thyroid hormone. But if it is hyper and you want to use the medication route to minimize the secretion, there are other medications that you can use for that. But again, it's based on what else you have going on will determine the right choice of medicine for the patient to use. So yeah, these are great questions. Thank you for bringing them on and engaging. Feel free to throw in other questions if you're watching in a replay so that I can circle back and answer those questions, because thyroid health is so important. I'm so happy that the month of January is a month where we are creating awareness of the thyroid disease, because not many people are aware of the thyroid disease, and it does mimic so many other conditions, and it's really broad, and women tend to be affected a lot more than men with the thyroid disease. So we do need to be quite cognizant of the symptoms. Just to reiterate about the symptoms, right? It's anything that affects our metabolism, right? So it's either too slow or too fast. So just imagine the array of things that can happen: excessive eating or not eating at all, excessive sleeping or not sleeping at all, weight gain or weight loss, cold, heat intolerance. It could just be brain fog, because again, the thyroid gland, it's a thermostat, right? You have a thermostat in your house that regulates the temperature of the whole house. It's the same thing. As small a gland as it is, it does affect a lot of things, and its secretion starts in the brain and signals to the gland right here that, you know what, I need some hormone to help to carry on the work of the body as a whole, because there are receptors in every area of the body. So we do need to pay attention to those different things. What causes the thyroid to get out of whack? Yeah, quite a bit causes the thyroid to get out of whack. I'd mentioned a few, like stress. High levels of stress can confuse the thyroid gland because of high levels of cortisol. That can get it out of whack. Definitely nutrition, if we're not eating the right foods, because it needs to be supported, right? You know, how if the foundation is wrong, everything else is unstable. So that's the same thing. If we're not eating the right foods, you can actually affect. Now, some of it is genetics, of course, but I have patients where nobody in their family, no one, absolutely no one had thyroid issues, and they ended up having thyroid problems. So again, it could be environmental. Even though you see some data that will say it's still a mystery about what causes hypo versus what causes hyper. But there's a lot of scientific evidence that shows that nutrition, what we eat, so having a balanced meal, eating the right nutrients, the antioxidants help. As for Hashimoto, which is where your body attacks itself, that is also an unknown cause and an etiology, but we have found what can help to minimize it. So a lot of patients that have thyroid issues have found that when they convert from eating fatty animal products, that their thyroid actually strives better in a predominantly plant-based environment. So those would be some that I will say. Yes, it does. It does. Absolutely. It affects the digestive system. It has receptors. And that's why patients could either have constipation or diarrhea, because it has receptors in the GI tract. So the GI tract is the house of everything. That's where all our hormones are partially made or fully made there. So yes, it can affect the GI tract. It affects most, if not all, organs of the body. So we definitely need to take care of this little organ that we have here. Well, we are on 30 minutes on the clock. I'm excited that I've had the opportunity here to just educate the community about their thyroid. I want you to use the information. I'm hoping that you've been inspired, but use the information to implement at least one action step. If you haven't had your thyroid checked, it might be that they've checked it, but if it hasn't been checked, ask your doctor, do I need to have a thyroid test? Which thyroid test did you check? As I mentioned, it's not just the TSH, which is commonly what people know that we check. You know, maybe we need to include the T3, T4. If you're just not feeling right and everything's normal, you might need to do some further investigation. So talk to your provider, be empowered. It's your health, it's your life, so feel empowered. Hopefully your provider will listen to you and give you some solutions, and also provide some additional resources on how you can support your thyroid health. But we don't want to wait to when we're sick to take care of ourselves, right? Make time for wellness now so that you don't have to create time for illness. So that's my motto, that we need to support our health all together. Our thyroid gland needs us to support it. So I'm really happy that we've had a moment to talk about the thyroid. Let's see if there are more questions. Okay, I like these questions. So 5 glands associated with the thyroid, and then there was another question about only one gland was in trouble and said it was. Okay, perfect, excellent. That's great. Yes, you know, the thyroid gland actually has 4 other small glands that sit close to it, and that is called the parathyroid glands, and that works with calcium and all of that. So if there's anything off, and that's why you do the ultrasound. So I suppose the question that came in, it said that there were 5 other glands and one of it was the issue. And once they took it out, the hyperthyroidism was cured. Again, get into the root cause. What's the reason behind the hyperfunctioning thyroid? So if it's because of a tumor, take it out. If it's because of hypersecretion, you can minimize that with medication or radiation. So whatever the root cause, definitely. But yes, you're correct. There are other small glands that sit around the thyroid. The thyroid is right here. The thyroid gland sits across the trachea, but then the 2 other the four, two on left and two on the right. If anything there is abnormal, it can cause problems. Okay, it was detected by labs. Okay, all right, great. Yeah, the parathyroid glands, you can check the levels by checking the calcium level. And not to make it go more technical into the medical jargons, there are other tests that you can check, but focusing on the thyroid gland is definitely the TSH, the T3, and the T4. And they are antibodies that you can check for the thyroid gland, especially if you're thinking Hashimoto and see, well, is there something attacking my thyroid and preventing it from working the best that it can? All right, very good. So I'm excited. I'm really pleased that we're getting all these questions and engagement. I definitely want you to use this as a sign to check and inquire. If you don't know, you wouldn't be able to do anything about it. So, but now we know. Once we know, we can do better. So check, check, check. There was a time where that we go by evidence-based medicine where it was required to check TSH on everyone for your annual physical, but that's no longer the guidelines. It has to be indicated. So you have to have some complaint of some sort for them to check a TSH. So just make sure that you ask your doctor or your provider at your next visit. Okay, so a prevention in time, I always say prevention is better than cure. So I want to pat with that and just empower you all that you deserve to live healthy and strong because you're worth it. So give yourself the time of day to have it checked. And I thank you all for listening and for all the great questions. And I look forward to returning next month for another episode of Holistic Perspective, where we see about our health, where we talk about our spirit, soul, and body, so that we live whole lives, because that's how God has called us to live, to impact the world around us. So thanks again for tuning in. Until next time, take care and God bless.